Welcome to the podcast where we discuss health, health span, lifespan, and longevity. I'm Dr. Noor Gajraj. Welcome to the podcast. My name is Dr. Noor Gajraj. Today we have Dr. Attilio Cavezzi again. He is a specialist in vascular surgery and an expert in longevity medicine. He is medical director of Eurocenter Vena Lympha in San Benedetto del Tronto, Italy. He is the past vice president of the International Union of Phlebology. He has received many awards. He is author of more than 100 publications about vascular diseases, longevity medicine, psychoneurobiology, and hormesis. Today he's going to talk about the power of thoughts on health and longevity. We know this is an important subject. Optimists live longer than pessimists. So over to you, sir.
Thank you, Noor, for your kind invitation again. And the topic is very interesting, in my humble opinion, because it has been somehow neglected how mind can influence our body, and so how it can influence, let's say, aging and more generally chronic degenerative diseases. To be short, I would immediately share my presentation. Okay, we talk about psychoneurobiology, which means the network, as we will see, which connects mind and body. And also we will talk somehow about the fundamental power of thoughts on health and longevity. I'm a vascular surgeon, but in fact, I'm interested in longevity medicine. And the more I study, the more I talk to my patient, the more I understand how important is this relationship between mind and body. So we know that aging and chronic degenerative disease depend mainly on epigenetics, which means nutrition, lifestyle, but I start to highlight how important is, from the epigenetic point of view, the stress management, the kind of mind-body relationship and resilience. Also, environment can be important, of course. So having said this, the importance of epigenetic among all the possible factors in the epigenetic influence on our aging and on our health and disease, we will see how important is the issue of psychoneurobiology. In fact, medicine is having some problem, and for example, it is still considered the third leading cause of death. Why I'm telling you this? Because still we are looking for a better approach to aging, to chronic degenerative diseases, and that's why I'm writing from time to time articles and so on. In fact, in the last 100 years, we know that we have prolonged the average lifespan, but we have not absolutely prolonged the average health. That's why we are paying a quite high price. I mean, most people above 70 years of age are full of drugs, at least in Italy, I don't know, in USA, and technologies to go ahead, because they are full of a lot of chronic degenerative disease, such as diabetes, obesity, neurodegenerative disease, atherosclerotic issues, autoimmune, cancer, and so on, and disability. I asked artificial intelligence if we are working well, can we cure chronic degenerative disease? The reply was very clear. No, we can't, because we can help about symptoms, about quality of life, but we still don't fully understand these diseases and aging as well. So as we cannot definitely cure these pathologies, we should pay attention more to something which is probably escaping the current medical approach nowadays. For example, we talk about nutrition, and that's good. We talk about lifestyle, smoking, physical activity, sunlight exposure, and so on. But we should talk and take into consideration much more stress management and the concept of psychophysical resilience as a main factor of aging and of the balance between health and disease. This was clearly understood a long time ago. Let's say nearly 200 years ago, they started to talk about mind, emotions, how they are important in terms of health and disease. And also this second book, you can see how they take care of mind and body connection. Michelangelo understood it. In the Sistine Chapel, for example, you see how the finger from the brain reaches the Adamus, okay, Adam, sorry. And this means that already Michelangelo put in connection mind and body, brain and body. This is somehow the fundamental of psychoneurobiology or psychoneuroendocrine immunology. It's a kind of system which is inside our body, a kind of network, we can say, which regulates a lot of stuff. It's a bidirectional relationship between the mind, the psychological aspect of our daily life, and all the neurobiological systems. So it should be a kind of pathophysiological and clinical paradigm with which we should approach differently human health and disease. So psychoneuroendocrine immunology was somehow founded by Celia, who started to talk about stress, acute stress, chronic stress, and the relationship between mind and body, which should not be divided as we do today between medicine and psychology. This is an integrated self-regulation network which maintains a balance whenever possible. So it means that we respond every single second to any organic, environmental, psychosocial impulse or stressor which are around us.
Yeah,
So
that
psycho,
yeah, that makes a lot of sense. I mean, originally it's kind of unfortunate that the like Descartes split the mind into the body. They didn't understand too much about the mind, so it was referred more to sort of artificially split off to psychiatrists. But
yeah.
it's a false duality, and I think we're trying to get more of a unified approach that you're talking about the mind, the body, and the spirit.
Yeah, yeah, absolutely. So these emotional states influence our biological state and vice versa. Basically, we are talking about how to cope with any form of psychophysical, chemical, biological stress. This is somehow resilience, and we will see in a while, to which in fact determines how we age, determines which is the possibility we get or we don't get metabolic disease, and so on and so on. One more thing which we will see is how the first 1,000 days of our life are important to imprint somehow this psychoneurobiology. So this is one of the very first articles which went into details from the biochemical point of view. This is a very small article we wrote in the past, and this is the classical diagram which connects the immune system, the neural system, the endocrine system, and so on and so on. Other articles here. So we are talking about a relationship between the central nervous system, of course, not only because we are also talking about the autonomic nervous system and the enteric nervous system. So we are talking about an interaction between central and peripheral nervous system, especially from the peripheral point of view, we mean the autonomic nervous system with our body functions. And this is based on how we cope with stress every single second of our life. Celia's stress curve clearly highlighted since the very beginning, I mean, 60, 70 years ago, how there is a huge difference between eustress and distress. Acute stress is probably beneficial in the vast majority of the cases, and we need it. We need cortisol to live and to cope with some specific stressor in an acute way. If we get a lion into a place, we have to run away, for example. And that's eustress, that's acute stress. When the stress becomes chronic, going ahead beyond the threshold point of maximum performance, then we get distress. And the distress zone means we are not properly coping with that kind of stress. So somehow this allostatic load, it is called allostatic load, generates inside our bodies, step by step, more and more, an adaptation syndrome. So chronic distress is a problem because the more we get stress from the chronic point of view, the more we change our balance and we go into diseases. So we know that stress cannot be eliminated, but it must be somehow managed. What does it mean? Stress response. Whichever the stressor, you see on the left a list of possible stressor. I wouldn't go into details, chemical, biological, psychological, and so on. Whichever stress, we respond. First of all, with cortisol through the HPA axis, hypothalamus, pituitary gland, and adrenal cortex, we know, and that's the classical cortisol response. But we have another very important system, which is the autonomic nervous system, and especially we respond through the sympathetic system in the majority of the cases. And that's the problem because adrenaline and noradrenaline, when we respond too long, too much, start to go high. And then we have other hormones and other substances and molecules which go around our body in case of a stress response. So, what happens when we have a chronic stress influencing our daily life, our body? Many things happen at the level of the neuroendocrine and neurological systems. For example, in the central nervous system, one of the most relevant issue is the amygdala hypertrophy, because amygdala, we know it's a kind of radar which has to detect what's happening and then drives our response. When we are too responsive, amygdala becomes hypertrophic, and then the immune system, the regulation, and all the metabolic and endocrine system alteration. This is what happens with chronic stress. So we have to cope with stress. And resilience is exactly the ability of a system, in this case, a human being, let's say, to adapt to changes, to adapt to stressors. Whichever stressor, we have to cope, we have to adapt. And I loved this editorial, which was issued in 2009 in The Lancet. They defined health has the ability to adapt to one's environment, which is really interesting. This is health, the ability to adapt. So basically, health is resilience. If this is true, if we look at literature, we find a lot of articles which connect psychobiological resilience with longevity, with aging. So the better, the greater the psychobiological resilience, the better the longevity. These are the studies which document it. And for example, these two very famous guys, Lopez Otin and Guido Kremer, clearly put the stress on the point that even cells should be considered more or less resilient to any psychological biological stress. And this is of central importance in cell senescence. And so if we look at studies, for example, the more we go ahead, and this is a quite young study because it was published 1 year ago, again, they demonstrate that when individuals have a higher resilience, they have a better survival curve, which is the opposite. When they have a lower resilience, they get a higher mortality rate and possibility. Adjusted even for age, gender, BMI, smoking, physical activity, as you can read on the red. So resilience is a key factor for longevity.
Yeah,
Another article,
sorry, I was going
yeah.
to say, yeah, I see resilience as the ability to bounce back from setbacks. And, when you look at people that have setbacks, the ones that have less resilience, they take it very personally. I've done something wrong, there's something wrong with me, and it's pervasive. It's not just this one thing, I'm bad at everything, and they think it's permanent. Whereas people that don't take it personally, I wasn't adequately prepared, or it was something came out of the blue, or they think it's,
Mm.
it affects all of their life is bad, and they think it's permanent, but things pass. So I think there are ways to become more resilient. I'm sure you're going to talk about those.
Yeah, yeah, we can improve, of course. So this study, for example, they associate through the data, the psychological resilience with all cause or cause-specific mortality in older adults. For example, here you see that basically when you get a higher psychological resilience profile, you reduce by 26%, hazard ratio 0.74, the all-cause mortality risk, which is incredible. 26% reduction of this risk simply working on our resilience. It is an incredible opportunity we have, and unfortunately, it is also an incredibly strong negative factor in the opposite case. How can we measure resilience? I was working on that. I wouldn't go long about this, but finally I found heart rate variability, which is a very simple technique, but extremely interesting to measure a lot of things. Basically, we measure the autonomic nervous system activity, but at the end of the day, we are measuring the, let's say, the resilience of the subject. So somehow, the higher the variability of the heart rate, the better the resilience. For example, a child has an extremely high heart rate variability, is a kind of drummer. On the contrary, the elderly are a kind of metronomes. They have no variability in front of any stressor or little variability. You see here, for example, how we work, different parameters, different graphics, and then we can get, let's say, some balances to understand what's going about the orthosympathetic system, parasympathetic system, coordination between the two, the total power, the energy of the system. So this is what we can imagine. But now let's move on because we know this is epigenetics. We have already talked about this. But in fact, what science is showing in a growing manner is that the first 1,000 days of life profoundly influence all the epigenetic factors, especially our resilience, especially our stress management. And we will see very clearly. What do we mean by first 1,000 days? Okay, we could say 1,200 or whatever. It's not important. We talk about early life adversities during conception, pregnancy, childbirth, puerperium, breastfeeding, and childhood. So basically, since the conception through all the life up to the third or fourth year of life of the child, then we know that many things may happen. And what happened during that period dramatically influence awareness, resilience, stress axis activation, as we will see. Stephen Cole was great because he called this kind of imprinting we get from the first 1,000 days of life conserved transcriptional response to adversity. So we respond to any stress, to any adversity in adulthood as to the imprinting we got when we were children or when we were inside our mom's belly during pregnancy and so on and so on. This means that we will overactivate or underactivate or properly activate the stress axis as to what we had in terms of early life adversities. And so we will have a higher or lower degree of pro-inflammatory reactions inside our body following this kind of imprinting. And we will see step by step. You see, this is a very complex drawing, but basically puts into connection the early psychosocial environment with all the possible biological changes during infancy, during childhood, and then at the end of the day, during adulthood, because we are the children and we were children, sorry, and now we are adults, but we significantly show what was imprinted at the very beginning of our life. For example, one of the most important things during those 1,000 days of life is the attachment we have with the caregiver. The usual caregiver is mom. So what happens between mother and child dramatically imprints and influences the way we cope with stress. I don't go through all these different stages or different um, aspects of the possible attachment between the child and the mother or the child and any kind of caregiver. But you see that as to the type of attachment, then the adult, as you see in the second table, will behave. So as in agreement with the kind of attachment we got when we were children, then we will behave. So we behave in our adult life as to the imprinting we received when we were infants or children. So you see the secure, dismissing, avoidant, entangled, or even unresolved and disorganized attachment can dramatically influence our adaptability to any kind of biological, chemical, physical, and especially psychosocial change we have during our life. So it's a kind of epigenetic signature that we receive when we are infants or children. And that means that our secretion of the corticotropin and all the hormones and the hyperactivation of stress is under this influence. Even BDNF can be more or less pronounced in terms of concentration depending on this care we receive or don't receive from our mother or from our parents or from our babysitter or from our grandfather and grandmother and so on and so on. So it's a lasting imprint on the biology of a children and then of an adult because we get models and we perpetuate these models along our life. Is it true? What happens in terms of psychoneurobiology if we look at the chronic degenerative disease? For example, let's talk about cardiovascular disease. We know that atherosclerosis is not, we were told, cholesterol or whatever. We know how important is nutrition, lifestyles. Now we have discovered the lipopolysaccharides, but last but not least, I would say the most important issue for the pathophysiology of atherosclerosis is the hyperactivation of the stress axis with a hyperinflammatory state. And this comes from the early life, from a reduced resilience awareness once more. This is a kind of summary of what I personally suggest as a model to look at the pathophysiology of atherosclerosis. That's why, for example, the optimistic individuals have a much lower risk of a myocardial ischemia or stroke, 35% reduction, as you can see. And this is a systematic review and meta-analysis. So we are talking about 230,000 participants. Also, optimism reduced the all-cause mortality risk, 14% less. So this is a dramatic influence we get from our personality on our risk concerning myocardial ischemia or mortality. Again, other study, that was a systematic review. This is a study where, again, optimistic women have less ischemic heart disease and also a reduced overall mortality, which is different in case of pessimistic, hostile, and cynical women. Another study concerning cardiovascular disease and relationship with psychoneurobiology. This is a study on nearly 25,000 people, control study, control study. And you see again that, for example, in presence of work-related stress and home-related stress, the odd ratio of having a myocardial infarction is 2.17, which is very, very important. Also, financial stress plays a role, and depression plays a role in terms of myocardial infarction. These are factors which are very rarely taken into consideration by cardiologists, but it is important to remember and to remind. Depression, financial stress, loss of interest, again influence the acute myocardial infarction and strokes. And even living alone. Living alone increases by 68% the likelihood of having a cardiovascular death, which is incredible in my humble
Yeah.
opinion. On the contrary, being married comparing to being widower, brings a lower cardiovascular death risk, and we reduce the risk by 36%. So these are figures which are completely unknown and not possible to reach with drugs or whatever to decrease the risk in this way through drugs or technologies. But we can decrease or increase, unfortunately, with our personality, with our personal life. Now have a look at cancer. Again, it's a multifactorial disease and has a very strong epigenetic basis. This study, this meta-analysis, for me, in my humble opinion, was of paramount importance. This study was definitely demonstrating that the incidence and mortality of several types of cancer is significantly higher in presence of low resilience. This is a meta-analysis of 165 articles. So this is pure science, pure evidence. We increase by 125% the risk of having a cancer or die of cancer in presence of low resilience. So it is probably the most important factor which generates cancer, low resilience. It's not a matter of unfortune, it's not a matter just of smoking, it's a matter also of mind. And it is also similar, a little bit reduced, the importance of chronic stress. As you can see, the hazard ratio is 1.56. So again, this study was really, really important when it was published. And when I read it, I was really shocked. Again, looking at the cancer, for example, women who experience two or more psychosocial adversity in childhood have an odd ratio of 2.1 to have cancer before the age of 50. So double risk of getting cancer if in your childhood you get adversities and then you get maybe depression and so on and so on. This is another study. These are two studies where they compare again highest versus lowest resilience individuals. And in general, to make it simple, for liver, for lung, or for, let's say, cancer mortality, there is a very clear connection. The lower the resilience, the higher the likelihood of having a cancer or of dying because of a cancer. And again, these are extremely high figures. Can you imagine that 4.64 as a ratio for respiratory tract cancer? So these are incredible figures, in my opinion. Diabetes, or better, diabesity, as the Americans say, diabetes and obesity. Okay, here everybody knows that diabetes type 2 may depend upon nutrition, physical activity. We know all this stuff, but we neglect too much the importance again of stress coping, of stress resilience. And for example, this is a study on 1.5 million patients, which is not so little study. And they discovered that the hazard ratio for diabetes is 1.51 if you have a reduced stress resilience. This is very simple to understand. This means cortisol. An excess of cortisol, an excess of sympathetic system, of course, drives glucocorticoids, drives insulin, and drives diabetes. But no diabetology takes care of this very relevant aspect. And now we look at something which shocked me again, type 1 diabetes. Everybody would say that, well, the child was unlucky. No, 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 no. The child was not unlucky. The child probably also had not very good parents. I'm sorry to be very strong, very tough, but this is something we have to keep in mind. These are two very serious studies from mostly the Scandinavian colleagues, and you see that early life adverse events can condition dramatically the onset of type 1 diabetes. The hazard ratio can go from 1.67 to 3. So you have a 200% higher probability of getting a type 1 diabetes if during pregnancy and in the very early life the fetus and the infant or the child get problems in family or inside the belly of the mother. So this is something to keep in mind. Sleep. Sleep is a fundamental part of psychoneurobiology. We will discuss a little bit in a while. Anyway, just this simple consideration. This is a clear demonstration. 6 days, just 6 days of impaired sleep increases blood sugar levels by 23% and insulin levels by 48%. In my daily experience, the vast majority of my patients sleep less than 7 hours, even when they are 30 or 40 years old. That means that sleeping is becoming a problem in Italy, I'm sure also in US. And when you don't sleep well, you get diabetes. And it's something, again, which diabetologists don't know at all, but it is of extreme importance. Neurodegeneration is also linked to all this stuff. I will go a little bit quicker. These are a few articles which can put in connection psychoneuroimmunology, multiple sclerosis, and so on. And for example, multiple sclerosis in this article from the Iranian colleagues, these are Iranian colleagues, if I recall well, well, they demonstrate that insecure attachment and immature behavior due to a complex first 1,000 days of life leads to a psychophysical lower resilience, and this was much more frequent in patients with multiple sclerosis. Other articles, and that's all. Psychopathologies. Well, when you hyperactivate the stress axis when in your daily life, of course, you are somehow responding too much to simple stress, such as a little cat which is entering your room is very different from a lion. But if you take the cat for a lion, that's a problem because this comes from the stress in infancy, in childhood, which was not properly managed by not by the child or by the infant, but by the relationship which we have with our caregiver. And that leads to a major vulnerability to stress in adulthood, which invariably can lead to psychopathologies. And there is a lot of evidence about this. Autoimmune diseases, I will go quick on this topic. We know, I don't want to go into all these articles, but we know that there is a deregulated immune response when we cannot control properly our emotional response. This has been clearly demonstrated in several articles, and this clearly leads to a deregulated immune reaction and to the classical autoimmune diseases, for example. This is a systematic review. Overall, they found an influence of exposure to childhood adversities on autoimmune diseases in adulthood. You see here in this graphic how clearly the exposure to early life adversities leads to a different management of our immune system. And so the incidence of autoimmune diseases increases. For example, these are some articles concerning skin autoimmune diseases, some scientific evidence such as psoriasis and so on. And in Italy, I suspect also in US, autoimmune thyroiditis, I don't know if it's pronounced well, the autoimmune thyroiditis is a matter also of lack of self-compassion. It's a matter of limited parental emotional support during our childhood. I know this is so strange to listen, but there are demonstrations, there are data which demonstrate it. So the Hashimoto thyroiditis is also a matter of what happens during the early life. For example, this is also true in case of any form of inflammatory gastrointestinal disease, such as colitis, such as Crohn's disease, and so on and so on. And now we go to what we are interested in specifically, which is aging and somehow mortality. How is the influence of psychoneurobiology on this issue? We know that optimism, you told since the very beginning of our podcast, optimism extends lifespan by 11-15%. So it means some 8 to 10 years more, which is not so easy to neglect. So if we want to live 10 years longer, we should be optimistic. And this is something to remember. Conversely, the adverse childhood experiences induce a premature all-cause mortality in a higher manner, especially for women. And you can see here how the risk of this premature all-cause mortality increases when you have one or two adversities during the early life. For example, this is an incredible study because they studied 17,000 adults for many, many years. Probably, if I recall well, it was something like 60 years. What did they find? They found that if you get a lot of early life adversities, for example, here on the right, you can read which kind of adversity: physical, sexual, emotional, economical, whatever, mental, mother, father, and so on and so on. These adversities, when they are six or more, people die 20 years earlier. 20 years earlier, which is a significant data to remember how important this stuff is. And again, in US, they've calculated that childhood adversity is responsible for approximately 439,000 deaths per year. That means 15% of the total annual mortality in US. So when we talk about mortality in US or in Italy, we have to keep in mind that 15% of the deaths depend upon adverse events during the early life. And probably no doctor considers this fact. This, for example, is another study which followed up for a long time people. And again, what shocked me is that we can die earlier, and we have, let's say, a 43% probability increase for parental neglect. So we don't need to be, let's say, beaten by our father, mother, drunk, narcotic, or whatsoever. Even parental neglect can induce an increase of all-cause mortality risk. And this is something to keep in mind. Here they studied more than 1 million children. So we are talking again about high level evidence. 1 million children were studied. And you see family poverty, induced premature mortality, death or threatened death of a parent or a sibling increases the hazard ratio. And when you combine so many adversities in early childhood, you get a 4 or 5-fold increased risk of premature mortality. And which kind of mortality are we talking about? Accidents, suicides, and cancer. So as we can see, we should completely review the way we approach the early life of our future, let's say, children and future adults. Even simple purpose in life is extremely important from the psychoneurobiological point of view. And you see how, again, the simple life purpose, when it is too low, increases the all-cause mortality because it is all related. It's a network, as I told. For example, we talked before about personality. The bad news are that if you have neuroticism when you are 65, they started to study at 65, the individuals, anxiety, anger, sadness, and emotional instability, you increase your risk of mortality during the following years. But the good news is that if you have this kind of personality and you change, you decrease the risk of mortality because still we have the possibility to improve our personality if we want to live longer, even when we are 65. This is important to keep in mind.
So I would
Again,
say, in my field, I treat a lot of patients with chronic pain. and a lot of those patients have early childhood trauma, and also psychiatric conditions are more common with a traumatic early childhood, and depression can make pain worse. So a lot of these things combine together in negative ways.
Yeah, yeah. Often it's a combination. Of course, it's not just a matter of one single factor, but as you correctly say, these patients should do their best to improve their awareness to cope with stress, which kind of stress, which means resilience at the end of the day. This is a Mayo Clinic study, and they studied, for example, pessimism, they studied anxiety, depression, and so on. Of course, pessimism was the major factor which increased the mortality risk by 86%, but composite neuroticism was the worst condition which gave the highest hazard ratio. Again, we are talking people who die earlier or live longer as to their psychological state, as to their personality. And this is a great study because they studied children and adults for a very, very, very long time. And they concluded that childhood personality can predict longevity. And this is an incredible study. This is true for females and for males. And they call it conscientiousness. Conscientiousness. We could say very simply awareness, which derives from the first 1,000 days and from all the rest that we know concerning the development of an individual personality. So now the last part of my presentation, it will be not so long, but I want to say, how can we improve resilience? How can we improve awareness? How can we improve our psychoneuroendocrine immunological system? Well, you see, this is a list. This is a list. I will not go through all this stuff because it's not the task of my presentation today, but I would start with loving oneself, living more in pleasure and happiness. It's maybe silly to say, but this is probably the most important thing we can do to improve our longevity. And then we have a psychotherapy, we have meditation, improve the sleep, and so on and so on and so on. The vagus nerve is very important. The Tai Chi, yoga, and prayer. So let's go ahead for a second. For example, this study, I read it some 15 years ago, 14 years ago, sorry. It is called Harvard Grant Study. They studied 268 students of Harvard College for 75 years. So they took them when they were 18, 19, and up to 90 or 95 years of age or whatever. So they studied all these students to understand which are the possible factors which predict a healthy or unhealthy aging. Okay? So they discovered, and this is easy to understand, that alcoholism was the factor with the most destructive power, and smoking was the second factor, and then many other things. But in terms of better longevity, they discovered that the warmth of human relationships throughout life was the greatest positive factor on life satisfaction. And so Vaillant, who is the main investigator, concludes saying that happiness is love. And even more important, in this study, the take-home message is let's cultivate the good social relationships if we want to live longer and healthier. So they discovered that the children who lived longer was the ones who lived more socially and had, let's say, better social relationships and a better attitude towards stress and towards life. Meditation is another very important thing that we know, even to change the telomere length. This has been demonstrated in several studies. Apple is a great scientist, and she's working on this about longevity. Mindfulness meditation shift the cognitive states from threat to challenge. So we decrease the rumination and reduce stress. And this has an influence not just on hormones or on biochemical issues, but on genes, on telomeres. We maintain the telomeres long, which means we maintain a better longevity through meditation. This is a meta-analytic review, and again, mindfulness meditation has an activity on telomerase. So our thoughts influence chromosomes. We want, we don't want, but this is what happens. Our thoughts influence our DNA. This is a fact. Sleep deprivation is a problem. So improving sleep, we can do a lot better for longevity. And in fact, again, as I told you before, the importance of sleep, for example, for diabetes, but overall, what has been discovered that to improve our psychoneurobiology, we should not sleep that less than 7 hours, let's say 6 to 7 hours, but we also should not sleep more than 9 hours. It's a kind of hormetic effect. I don't go through all the data, but you can read how important it is to sleep properly in the darkness and for a minimum of 6 7 hours per night, because we produce melatonin in the night, and because melatonin unfortunately decreases along the life. It means that when we are 70 years old, we produce much less melatonin than when we are 20. That's why probably we need melatonin as a food supplement or whatever. The more we age, the more we would need, very likely. Sleep duration also decreases, and again, this is something to keep in mind. Spirituality. Spirituality helps psychoneurobiology. This is a Harvard University study. They followed up 75,000, nearly 75,000 healthy nurses. Guess who were the nurses who lived longer and healthier? The ones who attended more than one religious service per week. We can say that you can go on the mountains, up the mountains, you can go on the seaside to get spiritual, uh, let's say, influence. You can go to the church. Everyone decides what is proper for himself or for herself. But spirituality helps to live longer. And for example, something which is somehow related to spirituality and to our personality is forgiveness. Forgiveness prolongs life. There are studies which are demonstrating it. Maybe the evidence is not so high, but I wanted to highlight also this issue. Now, just 2 words about hormesis. Charles Darwin told that the one who survives is not the strongest, not the most intelligent, but the one who copes better with the changes. And again, we are talking about resilience. This is Charles Darwin. And Nietzsche told, what does not kill me makes me stronger. This is the essence of hormesis. I don't want to go into detail because that would need a lot of time, but hormesis is probably the best option to improve psychophysical resilience through the exposure to several possible stressors, such as fasting, cold, heat, specific food supplements, and so on and so on and so on. Why? Because through hormesis, we improve mitochondrial function. This is an article of ours where we discussed how important is mitoremesis, because hormesis happens especially inside the mitochondria, and we invented the word mitoresilience. The better the resilience of our mitochondria, the better the biology functioning of our cells. Also because when our thoughts influence our genes, our DNA, they also influence our mitochondria. This has been demonstrated especially by Martin Picard, who works in Columbia University in New York. Here is Bruce Lipton and many other articles which put in relationship the thoughts with biology. For example, again, Harvard and other high-level journals show how mind-body therapies can be useful to lower the blood pressure, to help in cancer treatment, and so on and so on and so on. So, what are we understanding to go to the end of my presentation? We are understanding that there is a fundamental role for the adaptability to stress. We call it psychophysical resilience, fundamental role in human health. But also, we have seen the fundamental role of the first 1,000 days of life. All this determines, at the end of the day, our awareness and our thoughts. So, our thoughts derive from this stuff. And so, if on one side I do believe that we are what we eat, Feuerbach, I do believe that much more we are what we think, because our thoughts can really change the way we cope with stress, we cope with any uh, outer and inner input which can drive our health during our life. So, in conclusion, we as individuals can determine through our greater or lesser awareness, through our, let's say, our thoughts, through our resilience, our epigenetic, which means 75%, about 75% of our health and our psychophysical illness. So, lifestyle, nutrition, intake of beneficial or harmful substances, exposure to pollutants, and stress management. So, unfortunately, we come from our first 1,000 days of life. We cannot reborn and be reborn and choose proper parents, let's say, but we can change. This is important. Change is a must if we want to live longer, to improve our resilience. And we shouldn't simply delegate our health to our doctors, to medications, to technology. We should reclaim our health, following a virtuous path to improve our psychoneurobiology, which means our health. That's why I want to put again this slide which I put last time, because this is a great sentence which says everything. If you want to know your thoughts of yesterday, look at your body today. But if you want to know how your body will be, look at your thoughts of today. Your thoughts decide how long you will live. That's why this Tibetan proverb says the secret to living well and longer is eat half, walk double, laugh triple, and love without measure. This is pure wisdom. And Heraclitus said, day by day, what you choose, what you think, and what you do is exactly who you become. Okay, this is
Perfect. Yeah, that's excellent. You covered a lot of ground. So you've talked about the importance of a traumatic childhood, but we can't change our childhood, but we can reframe it. For instance, thinking, none of us have had a perfect childhood, but our parents did the best they can with the awareness of the world that they had. And it wasn't necessarily personal. We can also learn how to be more optimistic. And I have a joke actually. An optimist invented the airplane, and a pessimist invented the parachute.
parachute.
Yeah.
Yeah.
But it's got a lot to do with what we're thinking, and we have to be aware of what we're thinking and challenge those thoughts. Life is terrible. Well, what is so terrible about it? If you stay in the present moment and you don't go back to the past and you don't go into the future, the present
Completely
moment is
agree.
always pretty good. As long as you've got food and no one trying to kill you and a place to eat, things are pretty good, most of the
Here and now.
here
Here
and
and
now.
now.
Yes, that's mindful meditation. So, but I think we need to really pay attention to what we're thinking. We make up thoughts, they're not facts, and there are thoughts, and because we think them, we believe them. And we have to say, I'd say, put your thoughts in a court of law and start cross-examining. Well, why is that? Why do you think that? Most of our negative thoughts will fall away because they're not based on reality. They're based on some fantasy that isn't good. So I thought that was excellent. A lot of this could be addressed with cognitive behavioral therapy. I mean, it fits very well. That's why cognitive behavioral therapy is so good because it challenges your negative thoughts and it promotes healthy behaviors. The other thing that occurs to me is that to pay attention to what you're feeling. If you're doing something and it doesn't make you feel good, it's not good for you, and vice versa. So things that make you feel good, as long as they're not unhealthy, like overeating, things that make you feel good will generally make you live longer. For instance, having good relationships. All right, they'll make you live longer. Bad relationships don't make you feel good. There is a feel good factor, which I notice. I mean, when I'm doing my research, massage is good. Well, of course, we know that makes you feel good. Being in nature is good for you, makes you feel good. So I think pay attention to your thoughts.
If I can say it simple, your body knows what's
Yes,
good for you. Your mind may lie, but your
right.
body will never lie.
Yes. There are temporary feel good situations like drinking alcohol or maybe drugs. You'll feel good for a while, but then that wears off and you feel worse. So pay attention. I say to people, what makes you happy in life? Focus on that. Do things that make you feel good. Do things that make you happy. And it's very simple, actually. And avoid stress. Avoid stress, get sleep, do
Or
something.
manage stress better.
Yeah,
If you
manage
can't
stress.
avoid, for example, you can sometimes manage better, cope better,
Yeah,
and look for pleasure whenever possible, look for
yes.
happiness whenever possible, because life is not always pleasure and happiness. We know that. But if you look for bad, you find bad. That's for sure.
Yeah, that's
Because
what I tell my
if
wife. Don't look for bad things. You'll find them. Yeah, seek and you will find. Yes, you will seek and you will find. If you look for problems, you will find problems. If you look for the good, that's good. So yeah, mindset is really, really important. It's a shame they don't teach some of this stuff in schools, right? I think I always tell my wife they should teach this stuff in schools, how to have a good relationship, how to communicate better, how to get closer to the things that will bring you happiness. It's very lacking, especially in the United States where we have a very materialistic view. We don't have, I think people in Italy probably enjoy themselves better. You have better food, a nice environment. The food over here is terrible, so you should be very happy that you live in Italy.
But let me be critical also to doctors because all this stuff we are talking about is not so popular among
No,
university
no.
professors and so among students and so among doctors. So when we deal with the diabetes, with whatever chronic disease or longevity or aging, we should pay attention extremely carefully to this stuff. Otherwise, we miss probably 50% of the issue.
Yeah, I mean, and there are some basic, simple things that can have an incredible effect on people's lives. But we get busy with work, don't have time to exercise. And like yourself, I've come from pain management and addiction. It's a very disease-focused endeavor, isn't it? You're focusing on disease and disease, whereas now we're trying to focus on health. We're trying to sort of cut things before they get out of control, the stress and the sugar. It doesn't make sense to let all these things occur and then you're fighting them when the problem's advanced. Well, that was excellent. That's very, very good. I think that's a really unappreciated aspect, the power of the mind and the body and the spirit. A faith-based practice community, faith-based community has been found to increase life expectancy. And I think people that are basically more optimistic and upbeat, they tend to have better behaviors. They exercise and they eat better. I think people that are pessimistic, they don't really, or maybe don't have the inclination to look at these simple things as carefully as they need to. But anyway, I know it's 9 o'clock over there. You're very big, and I always say you need to get more sleep. You're doing a lot of work in the evenings.
No, that's okay. No problem. Okay, okay.
Okay. Well, I
I
have you
was
back.
happy because this subject is very, very nice for me. And the data I presented, which you probably knew
Yeah,
before anyway, the data are astonishing in my humble opinion.
I know. It's crazy. All right. Well, have a good evening. And again, I appreciate it very much.
Thank you very much, Noor. See you next time.
Yeah.
Thank you.
Please subscribe to my channel and read my new book, 100 Pathways to Longevity. Add 25 years to your life, available on Amazon.